Jaber with Cosmetic Surgery and Laser Center of El Paso. Today we are going to be performing a rhinoplasty. Here is a preoperative picture of the patient. So this would be a common rhinoplasty. It's a reductive rhinoplasty. You can see here we're going to reduce some from the dorsum or the bridge of the nose, and we're going to narrow the tip, possibly also do what's called an ALAR base reduction, or narrowing the flare of the nose, but that will be the last step. For the dorsal reduction, we're going to do a push-down technique, which will remove a small segment of septum, or the middle partition of the nose, make bone cuts, and push the whole dorsum, or bridge of the nose, down as a subunit to lower the dorsum. And then we'll make an incision here and lift the skin and do the tip work. So I'll show you some of the key steps as we get going. Okay, so I went ahead and removed a piece of the septal cartilage. So here it is. That's what's corresponding to what I drew right there. So this amount of septal cartilage that I removed is the amount that the dorsum is going to move down. So from here, we're going to make the cuts in the bone, and we'll push the whole dorsum or the bridge of the nose down, and it will come down corresponding to how much septal cartilage was removed. So that'll be the next maneuver. Okay, so now we're doing the osteotomies, or the cuts in the bone. So I have this already lined up. This is what the instrument looks like. So when people say break in the nose, this is what it is, but it's actually a cut put in the bone. It's not just a random breaking of the nose. So as I say tap, tap, my assistant will tap on the mallet. Tap, 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 tap. And that's allowing me to slowly put a cut right here in the bone. So that's what we're doing. And it goes slowly. Tap, 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 tap. And I'm feeling with my other hand. So that's how I know where I'm at. So I'm going to complete this osteotomy on this side, do the same on the other side, and then make a small incision here to complete the two side osteotomies with the middle osteotomy. And from there, we'll be able to push the whole dorsum down. Okay, so I went ahead and did the osteotomy on this other side, and then one in the middle. You can see the little incision there. And so the whole dorsum of the nose has been pushed down, as you can see there. And let me show you, I'll compare that to the preoperative picture. So you can see here from preoperatively how much higher that dorsum was. So the whole dorsum of the nose has been lowered. Now we're going to address the tip of the nose. Okay, so we're back. So I went ahead and elevated the skin, and we made some changes to the tip of the nose. It's always a combination between removing very little cartilage and sutures. So a small amount of cartilage was removed here from the lower lateral cartilage, or what makes up the tip of the nose, and then multiple sutures have been put in here to accomplish what we want. So when you bring that back down, and you can see the kind of the changes that have been made. And so we've narrowed the tip. So from here we'll close this incision, and I'll make and then we'll decide whether we're going to reduce a little bit here or not. Okay, so we've closed this incision. After some debate, I decided to go ahead and do a small ALAR base reduction, 3 millimeters, so smaller than the average. You can compare it. This side has been done, this side has not been done. And so we're about to do that left side, and then we'll be done with the procedure. Okay, so we're all done. So the things that we accomplished is we lowered the dorsum of the nose with a push-down technique. We opened the nose and narrowed and refined the tip. And then lastly, we did a small ALAR base reduction for the flare of the nose. So from here, just going to put some tape and a splint, and she will go to recovery room. Let me show you the preoperative picture as well. Okay, so you can compare the preoperative picture. Both the frontal view, how we've narrowed the tip, lateral view, how we've taken down the dorsum, and this, how we did a very small ALAR base reduction. So that's the procedure. It's technically probably one of the most difficult cosmetic procedures to perform correctly, but I hope this was helpful. I'm Dr. Mark Jaber, Cosmetic Surgery and Laser Center of El Paso. Thank you for watching, and I hope this was educational.